Hello, my name is Sara Howard, and I'm the staff attorney at the Illinois Maternal and Child Health Coalition.
Hi, and I'm Kathy Chan, the Associate Director here at the Coalition. In an effort to help explain the federal health reform legislation that was recently passed by Congress and signed into law by President Obama, Illinois Maternal will be putting together fact sheets, conference calls, and web videos designed to explain various provisions contained within the law. This particular video will focus on the maintenance of effort requirements that apply to Medicaid and the Children's Health Insurance Program, or CHIP, in the Patient Protection and Affordable Care Act. In Illinois, Medicaid and CHIP provide some, if not all, of the funding for our All Kids programs, family care, and moms and babies health insurance. I'm going to turn it over to Sarah to give a summary of these maintenance of effort requirements in Medicaid and CHIP, and then we'll go over some of the commonly asked questions.
Okay, the Patient Protection and Affordable Care Act was signed into law on March 23rd of this year. As part of the legislation, a maintenance of effort requirement was imposed on states in regards to their Medicaid and children's health insurance programs. This means that the state of Illinois cannot adopt changes to their eligibility rules and procedures that would make someone ineligible for Medicaid or CHIP if they would have been eligible for that coverage on March 23rd of this year. The reason for the maintenance of effort requirement is simple: to prevent people from losing their current coverage while the major components of health reform are being implemented.
So just to be clear, this means that Illinois cannot scale back income eligibility or impose barriers to enrollment or re-enrollment, such as an in-person interview, imposing asset tests, or requiring people to renew on a more frequent basis. Illinois also cannot eliminate coverage for an entire eligibility category within Medicaid or eliminate any portion of the All Kids program that's currently funded by Medicaid or CHIP. However, there is nothing in the new law that would prevent Illinois from expanding our Medicaid coverage program to additional individuals.
That's right. Illinois still has full flexibility to further expand eligibility to adults not currently covered by the family care or other Medicaid programs. In fact, the federal government has said that states may begin expanding Medicaid up to 133% of the federal poverty level prior to 2014 without a waiver at their current federal matching rate.
But it is important to note that Illinois does have the ability to cut in other ways, such as by reducing provider reimbursement rates or eliminating optional benefits. Illinois Maternal will certainly be monitoring any attempts to impose such changes.
So what if Illinois decides to scale back eligibility in Medicaid and CHIP and violate the maintenance of effort requirement?
If a state is found in violation of any maintenance of effort requirement, the state will actually forego all of its federal Medicaid funding, which will include administrative costs. Needless to say, this puts Illinois in a position to have an enormous incentive to comply with the maintenance of effort requirement. Sarah, is there an expiration date for these protections?
Yes. The maintenance of effort requirement applies to adults until January 1st of 2014, when the major components of healthcare reform are expected to go into effect. It will stay in effect for children up to the age of 19 until September 30th of 2019. But there is one small exception to the maintenance of effort requirement in healthcare reform.
Yes, so starting next year, if a state like Illinois that provides Medicaid coverage to adults with incomes above 133% of the federal poverty level, which we do through our family care program, which offers coverage to parents up to 185% of the poverty level, they can scale back that eligibility if and only if the state is facing a budget deficit. But this would exclude cutting back coverage for pregnant women and disabled adults. Of course, this is something that we will be paying special attention to.
Finally, let's talk about how the maintenance of effort requirement in healthcare reform works with the maintenance of effort requirement in the American Recovery and Reinvestment Act, also known as the stimulus bill. Even though these two bills have similar maintenance of effort provisions, there are some key differences.
Right. There are actually three main differences. First of all, the maintenance of effort requirement in health reform applies to both CHIP and Medicaid, whereas the stimulus bill only applied these to Medicaid. Second, the maintenance of effort requirement in health reform is applied for a significantly longer period of time, which is until 2014 for adults and until September of 2019 for kids. The stimulus bill's maintenance of effort requirement is set to expire on December 31st at the end of this year, but it's expected that Congress will extend the stimulus bill's provisions through June 30th of 2011. And third, any violations under the health reform bill would eliminate all federal Medicaid funding, not just the extra Medicaid fiscal relief included in the stimulus package.
Okay, well that's all we have for today. Thanks for watching and stay tuned to our website, ilmaternal.org/healthcare reform for more informational videos, fact sheets, and links about healthcare reform. If you have any questions, feel free to email me at showard@ilmaternal.org.